All right, guys, we need to talk about IV tubing and drip rate and all that kind of fun stuff. So you can see I've got a lot of different IV bags hanging here. And what we're going to do next is we're going to prime this tubing so that, and this one goes through a pump. And if it goes through a pump, you do not have to calculate IV drip rate. But if it doesn't go through a pump and you do a free flow or a gravity infusion, then you probably have to do some calculations of drip rate. So over here, we've got different types of tubing. This is what we call secondary tubing, and it's a short line, and it's what you're going to do like your antibiotics on in your quick infusions. This one is probably what's in your bag, and it's just a primary set of IV tubing, which is what we're going to practice with. And then we've got some extension tubing, so maybe you need a little extra length, like they're getting ready to go to surgery or a procedure at St. E's, and we need a little bit more length so that anesthesia can give their medications to them. So you'll see that a little bit too. So what we do is we have our saline here, which is what our doctor ordered, which is just a little 100 bag of normal saline. Okay, we're gonna open our tubing here. Okay, and you can see that it's all nice and coiled up. Now this cap on here keeps that tip sterile, and that tip is a little sharp even though it's plastic, so be kind of careful. All right, and we've got this tubing that we're going to kind of go through here. All right, what we're going to do now is we've got our saline here, and we've got this blue cap on here. There will be different colored caps depending on the facility and the brands they use. You're going to pop that off, and then we're very carefully going to take, because we want to keep everything sterile to sterile, right? We're going to take this off, and you see the spike there, and you're going to stick it in. And you kind of do a little twisty motion. It's not like a screw, like you're not screwing it in, but you're kind of twisting it until you get some fluid. And what I like to do is I like to clamp it off before I start priming it, because once I start priming it, man, especially if it's a medication, it gets all the way through there. So I'm going to squeeze the chamber and get some fluid in there. And then we're going to come back over to our pole here, and we're going to hang it up because I just don't have that many arms. Okay, and then we're going to unlock our roller clamp, and we're just going to watch it come all the way through, and we want to get as many air bubbles out as possible. Now it takes about 10 mLs, I've been told, to really cause some problems. So little bubbles are okay, but any big bubbles we really want to get out of there. Now, the biggest thing is it doesn't do any good sitting here, hanging here. We want to give it to our patient. So we're going to come over here to our patient after we've primed our line. All right, and we're going to say, "Hi Jane, I'm here, I'm going to start your fluids." We pull out our alcohol wipe, okay, and we're going to clean that hub and make sure we get it really clean. You want to get it nice down and on the threads of the hub, okay? You're going to flush, because we don't know what's in there and how long it's been sitting, so we want to get that air bubble out. And we're going to connect it and twist. And we're going to flush, and when we're flushing again, we're looking to make sure that the IV is still good, that it flushes easily, and that there's no like bubbling in the skin happening, or that there's no saline leaking out around it. Okay. And then I'm going to uncap it, really careful to keep those tips clean. Remember, I've already cleaned this one. Okay. And we're going to connect it, and then we do the same thing, kind of screw it on there. And then we'll work on calculating drip factor with this one, but then you come back over here and you would undo your roller clamp until you see some drips happening, and then with the calculated drip rate that you have, you would match it up and get that to it. So that is how we prime tubing and then connect it to our patient.